Hello, my dear students. In this video, I will describe about the characters of discharge in chronic otitis media, mucosal disease and squamosal disease. This is very important from your examination point of view, especially from practicals in long case. So you should know to differentiate chronic otitis media mucosal disease from squamosal disease, usually by history of discharge alone. So let's move on the topic. The discharge in chronic otitis media, mucosal disease or CSMTT is usually intermittent in nature. That usually happens when the patient has common cold or when the patient has gone to swimming or when the patient has taken cold drinks. The discharge is usually aggravated by common cold when there is station tube dysfunction or when there is congestion of the nose. The discharge is copious in amount due to presence of goblet cells which secrete mucin in the station tube area and the medullary cavity. The discharge is usually whitish to yellowish in color. When there is infection, the discharge becomes yellowish. Otherwise, it is whitish. It is sticky in consistency because of goblet cells secreting mucin. And the discharge is not foul smelling because there is no bone erosion and it is not blood stained. There is rarely presence of granulation tissues in chronic otitis media mucosal disease, but sometimes it may be blood stained due to polyp. The duration of discharge per episode and last discharge are to be asked if the discharge is intermittent, that is, in case of chronic otitis media mucosal disease, because the discharge per episode may last for 4 to 5 days. That means we know how long does it last. And the last discharge is very important to ask because that signifies the stage of disease. The disease may be active, inactive, or quiescent stage according to discharge. Whereas in case of chronic otitis media squamosal disease, the discharge is continuous because there is continuous low-grade infection of the bone, so that leads to continuous infection or continuous discharge from the ear. The discharge is scanty because of absence of the goblet cells in the atic and the antrum area as well as the mastoid ear cell system. The epithelium there is usually cuboid epithelium to flat epithelium. The discharge in chronic otitis media squamosal disease is purulent discharge because of pus, that is infection. It is not sticky because of absence of goblet cells in that area. The discharge in chronic otitis media squamosal disease is foul smelling because of presence of keratin debris, keratin mass, and cholesteatoma. The cholesteatoma usually degrades the bone. There is bone erosion and there is persistent low-grade infection by the anaerobic organisms which leads to foul smell. The discharge is usually blood-stained because of presence of granulation tissues in the eticanthal type of disease or squamosal disease, where there is persistent trial by our body to control the infection that leads to granulation tissues. I think you understood the difference between CSMTT and CSM eticanthal type. Please subscribe my channel for more videos like this. Thank you.